parents are sending us is, my child is involved in team sports. They're involved in gymnastics or dance. Isn't that good enough? Isn't that enough physical activity?
Why do we need PE
Why do we
if
need
my
that?
children are active in organized sports and that kind of thing?
There are a number of issues and ways to answer this question. We're going to touch on a few of those, and it's probably not an exhaustive answer. One of the elements of team sports is how much actual activity is the child getting. You want to comment on that?
Sure, and being involved in youth sports and coaching in youth sports, I see that you have an hour of practice a week and you might have an hour of a game. And so within that hour of practice, there's instruction, you're trying to teach some new skills. So in reality, in an hour of practice, that child might be getting 15 or 20 minutes of actual physical activity. And then if we move to a game, they might be getting, again, 15 or 20 minutes of actual moving around, being active, running around. And that's in an active team sport. If we're playing a sport like baseball or softball,
There's quite a bit of waiting.
there's a lot of standing around. There's very little activity. And that's not really benefiting our children.
So from a physical fitness activity perspective, circulatory activity perspective, it's not as active as we might think.
No.
There are other elements to consider when we talk about team sports, and that is, are basic movement patterns being coached? In my experience with just being a coach for Pee Wee soccer, myself at one time, I wasn't necessarily teaching these children how to do basic body movements. We were saying, okay, let's kick the ball. I'm assuming, of course, as a parent, that if they practice dribbling the ball, however they happen to be doing it, flinging their body around, kicking the ball, if they do it enough, they'll get better at it. Well, my argument now as a physical education curriculum developer, that's not good enough. I mean, we really look at these sports activities as being complicated movement patterns. They're movement patterns that require coordination between lower and upper body, like batting, for example, or basketball, anything that's you're running and dribbling at the same time. How many of these movement patterns are being coached at a fundamental level and then move upward? In other words, fundamental movement patterns are not being coached, and the child is not increasing their skills in these kinds of movement patterns.
And that's where most coaches are parents that want to spend time with their kids, and they're not trained in how to progress through fundamental movement patterns. And so that's where you need that outside physical education that stresses and develops those basic fundamental movement patterns so that our children can run, they can shuffle, they can skip, they can catch a ball, they can hit a ball. That's where that comes into play.
When the body is developed sequentially, very deliberately in these movement patterns, then all the other activities in sports, whether it's running, batting, sprinting, lateral movements, jumping, all of those types of activities that you would expect to see in sports become more proficient because the core movements are already rehearsed and practiced and the person's skilled at it. And there's another element that I want to bring about, and that's injury. You want to talk about that?
That's critical. Obviously, learning to move properly is going to reduce the injuries. And so do we put our kids in compromised positions if they're not learning the movements properly? So they develop a pattern that may help them do that movement, but it may put them in a compromised position.
And with the element of team sports, there's a performance urge. I mean, there's a competition, there's a performance. The child is induced to try harder at something their body might not be ready to do. And so rather than sequentially build up the child's skills through a very series of very deliberate program and movement programs to help increase those skills, they're sort of thrown into a situation of performance where they're going to be up against their peers, they're going to be batting, or they're going to be catching, or they're going to be in basketball passing and throwing it, putting the ball up into the hoop. And if they're not performing that well, it's going to create an anxiety. It's going to create an urge to push their body and make it do what they want it to do without the underlying training. And that is a recipe for injury. Not to mention, I mean, it's actually physical injury as well as emotional, psychological injury.
And then out of that, so that's why we see, when kids hit 12, 13 years old, things start to get a little more competitive. They drop out of sports. And so we see numbers like 80% of children 12 and older are not involved in any type of really physical activity, because in our culture in the United States, what is there outside of team sports? You know, if you're not playing on a team when you're 12 or 13, what other options do you have?
Right.
And then that
So
just
when,
starts to develop some other lifelong health problems.
So a child that is physically unskilled ends up dropping out of sports, which means they have no options whatsoever, and that's another element of that's it's a slightly different twist
It is.
on the answer, but yes, that's an important element.
And when they get older then, and I experienced this working with college students, kids that didn't play sports or they dropped out at 12 or 13, and then at 19, 20, they want to learn a new sport. They want to learn to play tennis, or they want to learn to play golf, or they maybe want to do some rock climbing. It's really, really hard at that age to pick up those skills, to learn those new skills. It takes a lot of time, it takes a lot of effort, and there's going to be a big cost involved as well.